So I've been in academic medicine for most of my professional career, and I was really looking for a place where I could practice academic medicine and be part of a residency program where they were fully integrated into the hospital system. And that was one thing that really attracted me to this position, is that graduate medical education in general is incorporated into virtually everything that our hospital system does. One of the things that set our residency program apart is the fact that we make sure that all of our residents get exposed to each and every subspecialty that we offer, and that's not necessarily the norm at internal medicine residency training programs, so I think that is something that sets our program apart. We have an excellent fellowship match rate. About 75 to 80% of our residents go on to fellowship training programs, and so they have opportunities not only here at the University of Missouri, but at multiple programs across the country.
I really liked the 4+1 model. I really appreciated the opportunity to be a clinic doctor when I was in clinic, to focus on my inpatients when I was not, and to have the known weekend off to look forward to.
4+1 is a primary care continuity clinic, but when you do it in a 4+1 curriculum, you do 1 week of that clinic, independent, separate from any other responsibilities. Then that is followed by 4 weeks of rotations that are not primary care clinic. So it could be inpatient, could be subspecialty. So it allows you to focus on primary care clinic that week, and then when you're on an inpatient rotation, you can solely focus on your inpatients. And so dividing it up has really been popular with the residents.
From day one, I was able to jump in and be involved rather than competing with the other residents I was working with. They really supported me. I was a brand new intern, and I felt like they just really helped me learn how to do procedures. I got to do a lot of central lines when I started here, and my senior residents could have been like, here you go, kind of sink or swim, but they really helped teach me through the process.
Our residents have a lot of opportunities to teach medical students here as well, not only in their 3rd and 4th years, but also in their 1st and 2nd years. So it really gives our residents a great chance to be involved in medical education as well. This is a great place to work. We're generally speaking very kind to one another, that we have each other's backs, and it's just a very collegial environment.
If you don't feel fulfilled, it'll show. And I didn't get that sense at all when I was looking here. Other places, sometimes you could get that sense, unfortunately. And I felt bad for the residents. One of them was just coming off a 24-hour call. We don't have that here for our residents, which I think that says a lot about a program where they treat you as human beings, not just cogs in a wheel.
You're gonna get pretty much every specialty. So if you're at that stage where you're like, I'm still not sure what I want to do, or if you just love everything, so you have that opportunity to see the specialties and see what you really want to do and really like, and we provide that opportunity for you. So I think that's one of the other big things.
We function both at the University Hospital and the VA Hospital, and they're right across the street from each other. So you have a great opportunity to provide different types of learning, different types of patients.
When you start as a new resident, from day number 1, we expect you to just show up to work. For the first 6 months at least, we know that you were just a medical student yesterday. We are not expecting you to pick up and solve the complex problems on day number 1. Not even day number 30, not even day number 60. So we will make sure that we will get you there where you are a functioning, adequate doctor who's going to go solve the problems in the world. But we will give you time to improve, and we will give you the support that you need while you're training here.
You get this intuitive sense for how the people are here, and that for me was one of the most important things, that I am with people who are like-minded. I care for the patient, and I want to be with people who care for the patient, and that compassion is there here, and I appreciate that.